Today we are here with Russell Steele, president of Nolato Contour out of Baldwin, Wisconsin. Russell, thank you for taking the time and talking about your organization and some of the innovations that are coming out of it. You know, one thing that has launched in the past month is your independent clinic. Can you tell us more about it?
So we've begun a primary care clinic. It's a group that we put together with 3 other area employers, which include the school district in the local area. It's about 1,100 bodies within the clinic. It's based on primary care, preventative care, provides really low-cost initial care, including free generic drugs and labs and that type of thing. So it's a real help for the first dollar that our employees have.
That really makes a big difference for your employees. What was the defining moment for you and your team of considering this particular option?
It really had to do with affordability of healthcare. So we had 2 years in a row of over 20% increases on a fully insured plan, and we knew we had to do something different because as you raise deductibles, it makes it less affordable for our employees, and so they really weren't seeking care. And we were able to identify that all we were having were what we'd call catastrophic incidents, as opposed to any small preventative care, taking your meds for high blood pressure, that kind of thing, wasn't happening because it was too expensive. So we knew we had to do something.
Into a plan that's going to be more preventative and more proactive for your employees, which is pretty cool.
And they're able to access that at a very low cost or no cost, versus a couple $100 for an office visit for 7 minutes. They get a office visit for 30 minutes for $25. And then they get free generic drugs they apply and labs that go with that and all that as part of the clinic service.
Pretty neat. Where did you learn about the concept?
Through a CEO peer council that's through the UW-Stout Discovery Center process. And we're very fortunate to have some people on the council that knew information. And we stole all of that information, very generous for them to give that to us. But then it took a lot to get after that. But I think that interaction allowed for the references and the resources to understand that, because it's a fairly complex thing to get involved with, I think.
I know that just by talking with you in the past, there have been some barriers that you had to overcome to move this ahead. What were some of those barriers?
Well, some of them were the health insurance companies, because we're a public company. We had to put together a justifiable cost plan for this as well. And to do that, we had to have our past claims data. And the health insurance company was not forthcoming, even though by contract they had to provide that. It took about 9 months to get through that. So it's kind of the perseverance to get through those kinds of things that cause a lot of issues. And then the general body of knowledge out there isn't really good. It's not a lot of people that are doing this kind of thing, although more and more are coming around to that. But we struggle to get that information, but we were fortunate to have some guides along the way, and again, out of the peer council, that was pretty helpful. So that's kind of how we started with that. The other pieces of data, I am convinced this is an ongoing learning process that, sometime, after I'm dead, I'll have figured it all out. But you just learn more and more. It's kind of an iterative process, and the savings and opportunities for your employees get more and more as that process goes.
Perseverance is what I'm really hearing, because I know that just listening to even when you were working through the process, it was kind of one thing after another to move it ahead.
Yeah, and a little bit of belief is important.
That's pretty cool.
Right? So.
Yes, it really is. Yeah, when you're starting something very new, and to some of these rural areas, it's really a concept that we don't even realize the potential it has for our own employees.
Well, and when you look, so Wisconsin, unfortunately, is one of the most expensive healthcare places in the nation, in the western part here for sure. And so we had to do something different. And the something different is the clinic. And we expect our employees, it'll take some time for them to start to use the service, but that's a critical piece of that.
What are you finding now? How long have you had it open? And what are you
just
seeing?
a short period of time.
Okay.
The level of interest is pretty incredible. I would say after many years of working with healthcare and benefits with employees, this is probably the most excited I've seen them about any particular thing. So, and it's on our campus, so they can It's not common doors or anything, but they're able to access it without, driving
Right.
someplace else. So that's pretty nice.
Yeah, that's very convenient for them. We often look at the EDA or university centers as being kind of that system around the region for stimulating some of these innovations. What could they be doing to replicate this in their region?
Well, so one of the things I would say about this isn't something that I would have probably believed in if I would have gone to a seminar or just listened to a seminar. It takes the references of peers in your field or similar fields to understand that, yeah, this is really possible and a thing that we could do. After that, then you can go to the seminars and do the learnings. But the interaction there is really critical to kind of build that knowledge base. I think that's a model that works in this area. Not sure if that's the universal model or not, but I think having a facility that allows that to happen is important. And it's not just healthcare, it's a lot of other ideas that fit into that mode. And I've said before that, present something to me in that environment that I wouldn't accept, that would stimulate an idea that would allow me to think about it differently. And you have to have the right environment for that. And I think that's how the university and the systems can help us.
It's nice. It's relationships, but it's also bringing together CEOs that have very different ideas in
Yep.
which they're putting in place,
Yep.
which I think does make a big difference.
And I actually think it's a pretty interesting part about our clinic too, is that, it's pretty interesting to think we're in a fairly small town and we've got, 3 other employers, one of which is a school district, a public entity, and they think it's a better idea than what they have now. So I think that's pretty special.
Which is huge for your collaboration with them.
Yep.
I mean, when you look at overall, just the impacts overall as to what it can do.
Well, and it's opened
the
up
two
the
of you.
whole environment of being able to talk to them about, the jobs that are in the area and the employers that are in the area and the possibilities that exist there. And as a manufacturing person, I find that we have many, many opportunities that people just don't know about. So.
Yeah, which is really nice.
Yep.
It opens up more doors.
Yep, absolutely.
Lessons to this point, I'm sure you've had them. What are they?
Don't do it at the same time you're doing a major expansion. It's a really bad plan. But I do think that the lessons we would learn is that on this particular topic, that you really do have to have somebody you can dedicate to some of that. It's not a 100% full-time thing, but it takes the dedication to do that and stay with it and be willing to learn things that you don't know yet. I shouldn't rail against healthcare companies, or the insurers, I should be more clear, but I think the transparency there is very poor, and it doesn't help provide reasonable cost healthcare to your employees. So that whole scenario, we'll watch how that builds in a couple of years, but I think that, my view is that one will have provided much better healthcare, but will also have reduced their cost in the system, and yes, our cost too, but the affordability of employer-provided healthcare isn't a foregone conclusion. It gets too expensive sometimes, but we can fix that, and that's, I think, what we've learned so far. It's a doable thing for sure. And employees are excited about it, and our clinic people are even more excited, which is pretty good combination, because they actually get to provide health care in a way they wanted to, which was to build relationships and help people stay healthy or become healthy.
It's a win-win.
Yep.
Your employees, the organization, healthcare overall. Yeah, a win-win when you look at some of these rural communities and the challenges that are faced.
Yeah, and it's a model that if you can put so we're not big enough to carry this off by ourselves. We don't have enough heads to do that. There's some magical numbers in this thing that make it work, so you can have a full-time clinic, which is what we have. So it will take other employers to get together in a different town, in a different place. But I think there's a lot of really positives that come out of that, not just the clinic itself. So.
Excellent. Thank you very, very much for your time this afternoon.
Thank you.
Appreciate it.